Evening. Good evening. I'm Dr. Sarah Levin. I am one of the deputy health officers at Contra Costa County. Thank you for joining us this evening for the third module in our three-part module series that is geared towards doing the basics in training caregivers, family and lay caregivers, in best practices of infection prevention and control. This was able to be produced by a generous grant from the National Association of City and County Health Officers. Contra Costa County was one of 25 state sites nationwide to receive this grant funding to build local capacity in combating COVID-19 specifically, but also looking towards the future. How do we build local capacity in health departments to better prepare for future infectious agents that can lead to real devastation, as we saw with COVID-19 in our long-term care facilities and amongst our elders. So I feel really honored and blessed to be able to be part of this project and to have with us tonight our frontline nurses who've been going into facilities throughout the course of this pandemic, doing trainings and assisting facilities to better institute best practices in infection prevention and control. So Christina Ponce is here with us tonight, and I'm also pleased to announce that as part of this ongoing work, in one of the outcomes of this devastating and horrific pandemic has been that the recognition that we really need better capacity in our local health departments to serve these communities of long-term care. And so Christine has just been hired in a new position within our health department that will continue to do this type of on-the-ground frontline work with facilities, and hopefully will be ongoing amazing resource to our larger community. And I also just want to give a shout out to our partnership with now Empowered Aging, formerly the Ombudsman Office, and Choice in Aging organizations who've been collaborators throughout this work over the course of the pandemic, and really have taught us a lot as a local health department on how to best address the needs in the community in a crisis like this of a pandemic. So without further ado, I'm going to get us going. What will be presented tonight is the third module in the series, and then we'll have a Q&A afterwards with Christina Ponce fielding those questions. So thank you for doing this.
All right, let's get going. All right. Hi, this is the third class of our infection prevention and control family and caregiver training, where we're going to focus on when an infection develops and also have a review of the past two classes. Now, if you've taken the past two classes, you'll remember me. I'm Nancy Paris. I'm a consultant in infection prevention and control, and I've been working for over 40 years in this field. I've worked with most healthcare settings, worked on a lot of outbreaks, but I've spent a great deal of time in long-term care, working in infection prevention and control in long-term care. Now, at the conclusion of this presentation, all of you will be able to identify when and why a resident may be placed on transmission-based precautions, identify the different categories of transmission-based precautions, and describe the family's role in an antibiotic stewardship program. Now, it's important to go over the precautions and the antibiotic stewardship program, because while you are providing care for your loved one, if you're a family member, or if you're a caregiver for the person you're working with, it's important for you to understand how these precautions are implemented and what you can do, because these are meant to protect you as well as staff. And one other note, because you will be caring and helping out with the care of your family member or the person you're working with, you are not counted as staff. But again, everything that you need to know that regarding precautions and the antibiotics and antibiotic stewardship program are important for you to also still comply with. So let's start with infection prevention and control precautions. We have standard and transmission-based precautions. I'm going to go over why they're initiated and when they're initiated. So first, we have precautions that are resident care activities that protect the residents, but they also protect healthcare providers, visitors, and everybody else in the facility. Compliance with these, or knowing what to do, is important. And again, as I just mentioned, it is really important for you to understand, because if your resident is on precautions, you need to know what to do and how to do it properly. Now, the infection prevention and control program in the facility that your loved one is in will have policies, and this will include standard precautions and transmission-based precautions and the types and use of PPE, which we went over in the last class, in class number 2, if you've already taken that. Standard precautions is a type of a series of activities that we follow on the assumption that all blood and body fluids harbor infectious organisms or germs. And we follow these with all residents, no matter whether or not they're infected with something we know about or not. It's just basic care activities, and I'll go into that a little bit more. And it's important for you to know and understand these. Now, when we have infections that are not managed, the transmission cannot be managed just by standard precautions. We initiate transmission-based precautions, which are in addition to standard precautions. And they're based on how we know that that infection is transmitted or is spread. So starting with standard precautions, this is a basic standard of care, and it's provided whether or not we know that there are any germs or organisms present. So these are steps we always follow, you will always follow, regardless of what the care is. Now, they provide a barrier protection, and they encompass all possible types of transmission, which I'm going to go over, and all portals of exit, which we went over in the class number 2, and from all body fluids that you may have any sort of contact with. The personal protective equipment that's needed by the caregiver, which includes you if you're helping with care of your loved one or the resident. The PPE are based on any anticipated exposure to any blood or any body fluids. We never officially initiate them. We never officially discontinue these. These are precautions, again, that are basic, that we always follow depending on the type of contact and exposure to body fluids that we're going to have with the resident. Now, next we have transmission-based precautions. So when standard precautions just aren't enough to protect us, we implement transmission-based precautions. So it's always in addition to, never instead of. And this I'll go through a little bit more, but basically if standard precautions mandate that you wear certain PPE, but transmission-based precautions are different, you follow the standard as well as the transmission-based. Now, the PPE that are determined to be worn are based on the category of precautions, and the category is based on how the infection is known to be spread. For example, contact, droplet, or airborne. And there's always a cart or some way that the PPE are available to you. And appropriate signage will be put out to indicate that your resident is on precautions and what PPE are indicated. And this is whenever an infection is suspected or confirmed. So it's not only known infections, it's when they think that there is an infection going on and looking at how that infection is transmitted or spread. So the modes of transmission include contact, which is direct and indirect, droplet and airborne, which we went over in class number 2. And the categories of precautions are based exactly on those modes of or means of transmission. Contact precautions based on contact transmission, droplet based on droplet transmission, and airborne is when we have airborne transmission. So they're very straightforward again as to how that infection is spread. So let's go over, what do precautions look like? What will you see? In general, with any category of precautions, there will be an isolation cart that will be at the door of the resident's room. Now, linen and trash all linen and trash for everyone all the time is always considered potentially infectious. So we don't handle it special, but we discard the linen or trash in the appropriate container, and we never go back into it and grab something that's always in. Once it's in, it stays in. The environment needs to be cleaned and disinfected, and depending on the type of precautions, we may need to increase the frequency of cleaning and disinfection, and that will be determined and that will be established by the nurses or the staff. And then certain infections may require certain special chemicals. Usually this would be bleach or something similar. It's nothing, anything exotic. It's usually a chemical that we're aware of, but certain different chemicals may be required. And again, this staff will deal with that. Now, visitation is really important. There are 2 aspects here. Visitors, which includes you, even if you're providing care for that resident, you need to understand the proper PPE that need to be used and how to use it properly. And if you are susceptible to whatever the infection the resident has or is believed to have, you should stay away. Even if you are important in the care for this resident, if you are susceptible, for example, if the resident has influenza and you have not received the flu vaccine, you need to stay away. That's for your health, your benefit. That's extremely important. Now, precautions get discontinued various times. It depends on the infection or infectious disease. Sometimes it's based on when that infection resolved. It's not based specifically on antibiotic or antimicrobial therapy. So the resident may finish the therapy but still be on precautions, but also the resident the opposite may be true, that the therapy may end, precautions are still continued, or therapy continues, precautions end. It just really depends on the specific infection, and the staff, again, will determine that and make it clear. Now, let's go over when and why. So standard precautions are a basic standard of care, as I mentioned, and they're observed on everybody all of the time. The resident can be placed in any room. There are no room restrictions. That means the resident is free to come and go within any part of the facility. Now, PPE are determined by the anticipated contact with blood and body fluids. So that includes you. If you are not having contact with any blood or body fluids, you won't need PPE. But if you are, you determine the PPE based on the type of contact that you're going to be having. In addition, we do not place an isolation cart at these rooms, but those PPE should be readily available in the event that you do need them. Now, again, we never discontinue special standard precautions. They are just always in the background, something that everybody is following. We don't post signage, because again, this applies to everybody all the time. Now, hand hygiene, which is something that we've talked about, you can perform with soap and water or the alcohol-based hand sanitizer or hand rub. It doesn't matter which, as long as you're following how to properly perform hand hygiene and determining the instances when you should be using only soap and water. For example, after toileting the resident, soap and water. Before feeding or handling food, soap and water. Most other times, the alcohol-based hand sanitizer is sufficient, but if you need to refresh yourself with when you use which, that's in class number 2. Now, contact precautions is implemented for certain infections that we know are spread by contact. And we went over this in class number 2. There's direct and indirect contact. And we initiate contact precautions for many instances when the germs are resistant to many drugs. But also, if the resident has diarrhea, whether or not we know that there's an organism or germ involved, and also with large draining wounds, whether or not those wounds are infected. In those instances, we implement contact precautions. Now, this may require a private room for the resident, and sometimes this will entail temporarily moving the resident to a different room and or changing roommates, depending on the status of the roommate, depending on a lot of variables. The staff will make that determination. You don't need to, you just need to be aware. Now, the other thing is there may be room restrictions depending on the infection. This means in some instances, and again, the staff will make this determination, your resident will not be able to leave the room for normal activities. For example, if the resident is having a lot of diarrhea and incontinent, which means they cannot get to the toilet, they will be restricted to the room. It is not safe for them to be out and about until this resolves. So be aware and please comply. Now, the PPE that are worn, typically with contact precautions, include a gown and gloves. And again, we went over proper wearing, putting on and removing of gowns and gloves in class number 2. In addition, I mentioned the cleaning. Oftentimes, there are certain infections that require different chemicals. And again, it's often bleach. And then maybe more frequent cleaning and disinfecting. And again, this is typically done by staff, but they may be asking you, and they would share with you the proper chemicals to be using. Now, there will be a sign at the door. And one note with regard to this sign, I have an example here of a sign. Each facility will have their own signs. It may not look like this, it may not be this color. It should say contact precautions. And it will also indicate the PPE that need to be worn. It will indicate gowns and gloves and good hand hygiene. That's the basic. It will not indicate what the person is infected with. That is not appropriate to be on a sign. But it will tell you what you need to know to protect yourself and to protect others in the facility. Now, hand hygiene is important, and if there's diarrheal infection, then soap and water is to be used, not alcohol-based hand rub. For other infections, alcohol-based hand rub or hand sanitizer is usually appropriate. Now, there's something called enhanced standard precautions that we follow in California. Not all facilities follow this, but it's just something to be aware of. And this is for certain infections spread by the contact route. And it's where the germs are resistant to many, many drugs. And so it's a little bit something different that we would follow. Now, again, the room may be a private room, and it may involve a room change of roommates. But one thing that is different is that the resident room restrictions are going to be based on an assessment of the resident by the staff, and they're going to determine that resident's ability to maintain good hygiene. If the resident is able to maintain good hygiene, they will be able to leave the room and participate in group activities. If their hygiene is poor, and this is not a judgment value, it is their ability to perform good hygiene, then they will have to be restricted to the room for the duration of being infected, or what we call colonized, with these organisms, with these germs. That means while those germs are present. Now, the PPE that we follow will be the gowns and gloves, but there may be additional extended use of the gowns and gloves. And the chemicals are going to be the same as we follow with as needed for contact precautions. But in addition, there will be constant assessments of the resident by staff to determine if they can downgrade or if they need to increase the precautions. So the determination to discontinue is based on the constant nursing assessment, which then determines when they can have the room restrictions released and so on. Now, again, a sign will be placed at the door indicating the enhanced standard precautions and what needs to be done. Hand hygiene will be soap and water or the alcohol-based hand sanitizer with the same restrictions of diarrhea or before feeding, when soap and water is always used. Now, the next category is droplet precautions. So this is for infections that are spread by droplets. And these are initiated most often for influenza. That's the most common infection. So again, it may require a private room, temporary change, or changing the roommates. And the room restrictions, once again, will depend on the infection. Typically with influenza, the resident will need to remain in the room until the precautions are discontinued. Now, the PPE in this instance would include a mask. In some instances, we may also include eye protection, and that will be determined again by the staff. Now, if the resident is coughing and sneezing a lot and it's uncontained, then as part of standard precautions, this is one instance where you might include a gown if you feel that their droplets will get on your clothing. So when I mentioned before, standard precautions are always in place. This is an example of how we would add standard precaution PPE to the droplet precautions. So the important additional measures are that anyone susceptible should not visit, as I mentioned before. So again, if it's influenza, if you have not had the vaccine and you are susceptible to the flu, please, for your protection, do not visit until your flu has resolved and when the staff tell you it is okay to come back and visit. Please abide by that for your protection. Signage includes a droplet precaution sign, and again, it may look different from this example, but it will be posted at the door to the room to indicate that precautions have been implemented and what PPE are to be worn. And hand hygiene, the same as with other soap and water, unless it's not indicated, unless it's soap and water or alcohol-based hand sanitizer, unless that's not indicated because the resident is also having diarrhea, you're handling toileting or preparing or handling food. Now, airborne precautions are indicated for certain infections that are spread by small droplet called droplet nuclei. This is most common for pulmonary tuberculosis. And in this instance, a special room, which is called an airborne infection isolation room, or an AIIR, is indicated. Now, most long-term care facilities do not have these types of rooms, as there are a number of requirements to have a room such as that. So the resident may need to be transferred to another facility. This is if pulmonary tuberculosis is suspected, it will be until either the infection is ruled out and they determine that the resident does not have pulmonary tuberculosis, or if it is pulmonary tuberculosis, it will be until the resident can come off of isolation, off of airborne precautions. Now, in these instances, the door will be closed, the resident will be restricted to their room, and this would be if the facility does have an airborne infection isolation room, or when awaiting transfer, or if you visit the resident in another facility, that's something that you will need to expect will be implemented at that facility. Now, in these instances, there is a special mask called an N95 respirator that should be worn, and there are special requirements for testing prior to wearing those. So once again, susceptible persons should not visit, should not be in the room with that resident. And if we're dealing with a family member or a resident that you've had a lot of contact with that is identified as possibly or definitely having pulmonary tuberculosis, you will probably need to be tested to see if you have become infected from that resident. So make sure to report to your physician or ask the staff at the care facility what you need to do to follow up. Now, a sign again will be posted on the door indicating what PPE are worn, and hand hygiene should be followed as with all other precautions. So those are the precautions that we would follow. And I want to mention a little bit about public health, because public health has a major role with all of our activities with long-term care. The role of public health overall is to promote a healthier environment for everyone. They are looking at the general environment of the community, looking at all levels of care, and wanting to make sure that all of us in a community are safe and protected. Now, they work closely with all types of long-term care facilities to support what they do. They also work with acute care facilities and ambulatory facilities and all others, but we're focusing here on long-term care. So they work very closely with them, develop really good relationships with the staff. It's important to note they don't regulate the facilities. There are other agencies that we talked about in the first class that do regulate. But if there's an issue, public health does communicate with those agencies and help to follow up on needs or on problems or concerns that are raised. So they work with us as a conduit to the regulatory facilities. And so it's important to note their role and be aware. Now, it's also important to know that there is something called public health reporting. By law, there are certain diseases and infections that must be reported to public health. So if the resident, if your loved one has a certain infection, and pulmonary tuberculosis is an example of one of them, that will be reported to public health. And what they do is they then follow up to determine who had unprotected contact, who was exposed, and to test and check to see if that person actually is developing an infection as a result of the contact or exposure. The healthcare provider does the reporting to public health. You don't need to worry about that. Public health does the follow-up, and if this ever involves your resident and an infection they are reported to public health about, you will probably be contacted by public health. Now, it doesn't mean anything has been done wrong or badly. Nobody is in trouble. This is for the health of the community because, again, they follow up on the contacts and exposures and make sure that the appropriate testing and treatment is done to stop any further spread of this infection. So it's a very important role, and it's something to be aware of and not concerned about. Another component of the infection prevention and control program is antibiotic stewardship. This is a really important program in all nursing homes as well as all other healthcare facilities. But it's important in nursing homes because, according to the Centers for Disease Control and Prevention, or CDC, 4.1 million Americans are admitted to or reside in nursing homes during any given year. It's a lot of people. Now, up to 70% of those residents received antibiotics during a year, every year. Antibiotics are the most frequently prescribed medications in nursing homes. And unfortunately, up to 75% of those antibiotics are prescribed incorrectly, according again to the CDC. So 40 to 75%, based on a lot of studies, have shown that the antibiotics prescribed in nursing homes may be unnecessary or inappropriate. This could include the wrong drug, the wrong dose, the duration of time that that drug is given, or why it's given. It may be that it is absolutely unnecessary, but it is given. 40 to 70% of the antibiotics prescribed, with 70% of the residents and up to 4.1 million residents. It's a lot of people that are getting these antibiotics. And the problem is that overuse with antibiotics may harm the resident. This could be either by causing illness. For example, when people get certain antibiotics, they may develop an infection called C. difficile or Clostridioides difficile disease, which causes a serious diarrheal illness. And some antibiotics may cause reactions. They could be sensitivity reactions, allergic reactions, or just side effects due to the drugs. The bigger problem overall, globally, is that overuse and inappropriate use of antibiotics promote drug resistance. That means that germs develop a resistance to those antibiotics, and it makes those antibiotics ineffective in treating the germs. And then the pharmacies need to search for different drugs that will treat these drug-resistant germs and so on. This is not just a local problem. This is one of probably the major public health global problem, public health problem. It's worldwide, and it's very serious. Now, the overuse or the inappropriate use in one person may not be harmful to that person as far as promoting resistance immediately. What it does is it causes a general overall resistance eventually with these germs. And the next time that resident has that infection and needs the antibiotics, they may not work. Now, for an antibiotic stewardship program in nursing homes, the CDC recommends 7 core elements that I'm going to briefly go through just to make you aware of. And here is a CDC chart summarizing those elements. First of all, we have to have leadership commitment. Leadership has to demonstrate support and a commitment to safe and appropriate antibiotic use in every facility. There's also accountability on the part of the physician, nurses, and the pharmacy to have a program in the facility and see that the proper antibiotics are being used. Also, there need to be appropriate pharmacists or others who can ensure, who have familiarity with drug expertise and ensure that the proper drug, dose, etc. are being used. The facility has to have some form of action, including a policy or practice, to improve their antibiotic use. And this is an ongoing program. Plus, they need to track what they're doing, because that's the way they know if they're improving or if they have a problem. And they need to report, give feedback to the prescribing clinicians, the nursing staff, and anybody else relevant. So this all, it's just to make you aware of what the facility is doing. And every facility will have a different way of accomplishing this, but it's important for you to know, but also education of clinicians, nursing staff, as well as residents is an important component of this. And that includes you. It includes you, your resident, your loved one, and anybody else caring for anybody or involved in the facility. So in summary of this, many, if not most, facilities have an antibiotic stewardship program in place. It's important to be aware that not all infections require antibiotics. And so be aware of this. And if you're told that your loved one has an infection, please discuss with the caregiver whether or not they need antibiotics, but evaluate their answer. For example, a viral infection won't be treated with antibiotics. They're not effective. That's not appropriate. There are other instances where antibiotics may not be the first required line of prevention or treatment. For example, with people who have organisms or germs in their urinary tract, which is pretty common in long-term care, antibiotics aren't necessarily the first step. What we do is we assess for signs and symptoms of infection, but what we do is look at other steps we can take, such as hydrating the residents, seeing if just hydrating them will eliminate those excessive organisms and help prevent an infection. That's very common and very commonly works. So work with your physician or care provider on what is appropriate. Don't automatically jump to asking for antibiotics. Now, as part of that, stay informed about the need for treatment and the appropriate treatment. So again, conversation, communication with the physician or caregiver to make sure about what treatment is being given, what is appropriate, and ask questions and get information. Support the physician in the diagnosis and determination of the treatment regimen. So again, don't always ask if the resident needs, don't always insist that the resident be cultured, for example. It may not be necessary to do a culture or a test to look for germs in the resident. The physician can determine when it's appropriate and when it isn't. Have a forthright conversation with them to determine how they're diagnosing and what is the appropriate treatment regimen. And if you're uncomfortable with what they're telling you, then by all means, go to the leadership in the facility. If there's a medical director, go to that medical director. If there's somebody else, you can talk to them, but try to support the antibiotic stewardship program. Be aware that that's what we're working with. Be supportive of it in every way that you can and supportive of the care that your resident is getting. So we have something else called diagnostic stewardship. And this is what the CDC tells us. This is based on improving the diagnostics and diagnosis as part of patient care. Diagnostics and diagnosis are two different things. Diagnosis is determining what's going on. Diagnostics is the tests, includes the tests that we do to identify what's going on. And this involves the physician ordering the correct tests for the right patient or resident at the right time to provide the right treatment. An incorrect diagnosis can lead to just prescribing an antibiotic when one is not needed, or failure to prescribe when one is needed. And again, this could lead to patient or resident harm. So we want to prevent poor utilization of resources. So for example, we don't need to do a culture on every time we think something may be going on. The physician can determine when it's appropriate and when it is not. And again, this is where we look for your support with the diagnostic stewardship program, in addition to the antibiotic stewardship program. What we're always doing is trying to find the right balance for our resident care. And we're looking at providing the least restrictive environment for residents to allow for adequate psychosocial interactions. In other words, this is their home, and we want them to be able to move to the best they can, because that's really important for their mental and physical well-being. So we're looking to provide this, But we also have to make sure that residents, staff, visitors, and everybody in the facility is protected. So we have to assess the resident to determine when we have to restrict them to protect everybody else. But we want to make sure to have the least amount of restriction in order to find that right balance, which assures the safety and best possible quality of life for your resident, your loved one, as well as everybody else in the facility. Now, I'm going to go through a brief review of the first two, actually of all three classes, and just highlight the points that we talked about in them. So, number one, your resident is in a long-term care facility. There are many different types, but they all have rules to follow, and they all have regulations that they have to abide by, and it's important for you simply to be aware and help the facility comply with those. Now, we recognize that the entire facility is the resident's home, and we have to respect that, and we do respect it, but we also need to comply with regulations and guidelines, and in some instances, the resident may be restricted to their room, and we have to recognize that each different type of facility has its own regulations, and there are different regulatory bodies that work with each different type of facility. And there are different types of licensees for different types of long-term care facilities. The regulations apply to different types of facilities, but in every instance, the facility is required to comply with those regulations. And again, it's important for you to, if you don't know, to talk to the facility, find out what the regulations are in your facility that you're working, that your resident is in, and make sure you're able to comply and support them. Now, there are also guidelines based on best practice. They're based on scientific evidence. They're not required, but because they're best practice, we usually want to follow them. And again, public health is there to pull all of these together, focusing on the prevention, protecting the health of everybody and improving the quality of life for your loved ones in that long-term care facility. So this is a combined ongoing effort with all of these. And again, the objective is improving the safety and care of every single resident. In class one, I mentioned surveys. And again, this is to ensure the facility is complying with those regulations for the purpose of keeping the residents safe. And they will vary between the different facilities, and you may be invited to participate with the survey. There are also advocacy groups, which are separate, and this is where they're looking to, again, improve the quality of life for long-term care residents. And it's important for you to be informed, and if you need to, reach out to them if you've got questions, concerns, or just need information. Now, we have a combination of facility responsibility as well as your responsibility. So the facility has the responsibility of maintaining programs for that have been there for a long time. This is not new, but there's become more public awareness of the programs that are in place. The facility recognizes the vulnerability of their residents, and what now is happening is we're seeing new and improved programs that we're able to implement in facilities, and there is legislation which is supportive of these programs. So we're benefiting with regard to this. The timing has been good for these facilities. But there's personal accountability that each one of us, you, I, and every staff member and your loved one or your resident need to follow. Now, families and caregivers and the residents themselves, we're finding they're more informed and educated these days. You need to make sure that you stay informed and educated, and we're more involved with the care and decisions of our loved ones. And that's important for you to be a part of, and the resident themselves if they're able. And again, this results in safer residents in our facilities. Now, family members and caregivers need to comply with the facility rules, especially those involving infection prevention, because that's for your protection. Understand the constraints, but also the risks of congregate living, which is what a long-term care facility is. Again, if you're sick, please stay home. Very important. Check with the facility to see when it's safe for everybody for you to return. It's important to understand how germs are spread from person to person, which we did go over in one of the prior classes. Practice good infection prevention. Use proper technique when you're wearing your personal protective equipment. Support a safe and healthy environment for the resident in every way. And most important of all, if you're not sure of something, please ask. There is no such thing as a dumb question. The only bad question is the one that isn't asked. Now, in the second class, we went over the chain of transmission, and it's important simply to remember an infection doesn't just occur. There are all these elements that are involved in an infection occurring in a person. And so what we do is we look to break the chain in every instance that we can. And again, this was gone over in the second class. And also what was gone over was these are the ways we break the chain: hand hygiene, cough etiquette, or respiratory hygiene, as it's also called, personal protective equipment, avoid contact with sick people, and making sure to clean and disinfect the environment. So a couple of points again: hand hygiene, because this is the most important ways to protect yourself, protect your family from getting sick. It is the easiest, the most effective, most important. And except for certain instances that I've mentioned, we use soap and water or alcohol-based hand sanitizer or hand rub. Technique and timing is important for effective hand hygiene. It's not just thinking that you're doing it, getting a little dab of sanitizer, running your hands under water. The way to do it matters as much as when and how you do it. And go back to class number 2 to go over the technique. Now, proper use of personal protective equipment is important, but I'm going to just review the face mask use. We always put on by the ear straps or ties, but pinch the nose for a good fit. Cover the nose and chin to ensure proper fit. And I see in the community, this is probably the most non-complied with way of wearing a face mask. I see them under the nose, under the chin, and so on. Now, also remove by touching the ear straps or ties, not by the front of the face mask. Once it's soiled or damaged, throw it out, or including a cloth mask if it's damaged. If it's soiled, you can wash it, but also the cloth masks need to be washed after each use because they get contaminated. And always, always, always perform hand hygiene properly after handling a face mask. Again, make sure your face mask fits snugly, avoid touching it, wash it after every use, and as we showed you in the second class, treat your mask like underwear. Do not touch or adjust, especially in public. Do not borrow or lend. Make sure the fit is tight but comfortable. Make sure it's clean, at least daily. Wear the right side out. If it's stained, throw it away. If it's damp, change it, and don't go commando. So keep that in mind. Now, this is from the Intermountain Healthcare, and this just indicates 6 daily habits to prevent the spread of many organisms, as viruses, as well as other types of germs. So avoid contact with people who are sick. Keep your hands clean. Avoid touching your face. Again, most infections we acquire from touching our eyes, nose, or mouth. If you have a cold or a cough in, or sneeze into your elbow, not in your hands, make sure that surfaces are cleaned and appropriately disinfected as needed, especially those that are touched often. And again, when you're sick, stay home. But also, for those of you that have children, keep them home. Keep them home from school, away from their activities if they're sick. We went over the modes of transmission and the categories of precautions, which are based on the modes of transmission. So contact, droplet, and airborne. And all will have signs and implemented by the facility as determined by the infection. And again, I went over the antibiotic stewardship program and the diagnostic stewardship program. Your role is to promote and support both of these programs within the facility. It's important for you to know what's going on with the resident, your family member, your loved one, or the person you're caring for, and get involved and ask questions. But again, as part of both of these, please don't insist on certain tests, especially when the physician feels that they're not necessary. If you have questions about the physician's decision, talk to the medical director, talk to, if there is one, talk to people at the facility, the leadership, and talk to them about it, but don't just insist on tests and antibiotics. And last of all, each long-term care facility and type of facility is unique. Be aware of that. And I've tried to cover generalities with all types of facilities. And the one that your loved one or your resident is in is going to be different from the one someone else is in. But always, no matter what type of facility it is, follow the correct practices for PPE use and hand hygiene, even if others are not, because they're probably doing it wrong. You can't be responsible for them, but you can be responsible for yourself, and you can keep yourself and your residents safe. And overall, stay informed and stay safe. So I thank you for your attention to this. And before you go, there is a survey that we would like you to take. If you scan from your phone this QR code before you end this program, it will take you directly to the survey, or you can jot down, it's a very long web link, but the web address is there that you can take this survey. But we would really appreciate it if you would take a moment to complete this survey. And if you have any questions about taking the survey, please contact Public Health and they can redirect you. Thank you for your time and your attention.
All right, let's see what questions we have. No questions tonight.
So maybe we can ask participants that if you do have a question and you want to just ask it directly, Mary, is it the settings on so that they can unmute themselves?
Let me double check. I'm doing it now.
So I think everyone's got access now. If you do have any of our participants, if you have any questions, feel free to unmute.
Kaya sa mapalagay, tinawagan niya, tawag siya ng tawag kung saan sa mga ano, which is okay din naman. So kahapon, merong lumalitaw dun sa screen ng TV, John Lee. Sabi niya, huwag mo na sagutin niya.
Didn't put their mute on.
Naka sa ano pala, 4 years in this area, maybe under your video sa kaya. Yun siguro yun. Yung video, ano yun.
No, doon sa labas.
Yung video.
All right.
Sa kanya umaga din, so ipakula. Yan, tatawag siya, hindi naman nag-return call. Nung nakausap siya dun sa office, so may Martinez siya.
I've got to learn Tagalog for sure.
So lahat. Siya nakikipag-usap. Sabi ko, okay.
May pagbumagal.
Ano lang yan, wala yan.
Okay.
So ganito,
Very-
sabi ko lang,
very-
ako, naglilinis ng banyo. Tinayuan ko na siya. Sabi ko, bahala ako, ikaw ang administrator. Kung sabi ko, ganyan, bahala ka.
You're on and you're not muted. Can you please mute? Okay, we'll give it one more minute to see if anyone's got any questions that they'd like to ask. And if not, we'll end the webinar. And while we wait to see if anyone does have questions, I just want to say that we do have everyone's registration. So we will be sending out further information on both that QR code that was posted at the end, link to a survey. We're hoping to we are going to make this available, these 3 modules available on our cchealth.org site, both our congregate living facility webpage, landing page, but also on the general site. And we hope to offer a certificate of completion of these modules that you'll be able to have that just show that you've gone through these modules as part of your commitment to being a lay caregiver in Contra Costa County. And we do also have some goodies that we hope to send out. We will be sending, receive if you registered with your email, a request for your mailing address so that we can send you our custom made masks, but we'll also be distributing them to facilities themselves so that if you do the, in the future, if others do modules online, they'll be able to get those as well as the certificate of completion. So, and we'll hope that you who've attended these will promote it amongst your colleagues and other families and friends that you know in the community. So I will stop there and give one more chance to see if we have any questions. And if not, we will end for the evening and let everybody get back to into the sunshine for the day.